Department of Health, as well as a medical expert on the dangers of the virus. And he joins us now live from Pretoria for an update. Sipho, a very good afternoon to you. I mean, what came out of your meeting with the officials earlier today? Should South Africans be worried about Zika?
Good afternoon to you, Alicia. Yes, I spoke to the National Institute of Communicable Diseases, which is an agency of the Health Department that deals with outbreaks and communicable diseases. We will remember them from last year. They also dealt quite strongly with the Ebola issue. But coming back to Zika specifically, they mentioned that the country does not need to panic as of yet, saying that there are no confirmed of cases of the Zika virus. But also what they've said is that even at airport situations, they're not going to be putting airport entrances rather. They're not going to be putting health staff there to monitor people as they are returning to South Africa, whether they're from the Americas where it has spread rapidly. They're saying that the Zika virus is not contagious, meaning that a person won't get it just by touching or being next to another person who's carrying it. So they're saying that at this point in time, there is no need to panic, and that they've got plans in place. Should there be a confirmed case, and they've got testing facilities at their headquarters where they will take that particular person for inspection.
All right. Look, Sipho, we've heard that usually the pregnant women are most at risk. But do you know which other group can also be affected by the Zika?
All right. Well, this was some of the interesting information to come out of it. They told us that Zika in of itself is not such a dangerous virus, in terms that if you and I just got it right now, we would probably present with headaches, fever, sweating, and some rashes. And it would probably last for a week or so, and then it will just clean itself out of our system. And if you got it once, then that means you will also now be immune to it. But then what they've said, the issue here is that pregnant women, is that it affects the unborn children, that it affects the brain development of children. And now when the children are born, they're born with brain damages. So that is where the main concern is. But if you're not pregnant, you're not expecting a child at all, then it's not so much of a problem. As I said, that it's not a fatal virus or disease for people that are not pregnant, but also the concern is around the unborn child and the damages that it causes to unborn children.
Look, Sipho, what did you find out in terms of any plans that have been put in place so far in order to try and, reduce or prevent the disease from reaching South Africa?
Well, what they've spoken about right now is that pregnant women should not exit the country going to populations where this Zika virus has spread rapidly. So they've discouraged those sort of travelers. But to everyone else who's not pregnant, they said if you are going to travel to those type of countries, just like any other country, then you got to make sure that you have taken your yellow fever shots or other precautionary measures that are needed for international travel. But the attention and the focus of the health department seems to be on pregnant women, saying that if you know you are expecting, don't travel there, because then you might be in a position where you catch this virus and it might damage the brain development of your child. And as we stand, we know that there is no virus or vaccine for it.
All right. Okay, before I let you go, Sipho, now, in terms of public awareness, how informed is the South African community? Where can people get more information on the Zika virus?
Well, people, the Department of Health has really just relegated the communication regarding this to the NICD rather, the National Institution of Communicable Diseases, and it's their website that has all of this information. I think on a daily basis, if you go to their website, they give an update on how far this disease has spread. But clearly, there's much more that needs to be done by the department to actually inform people of the dangers of this disease, because when you speak to people, there seems to be confusion. They don't know who it affects. Does it only affect pregnant women? The information that I got today, that if an ordinary person like me got it, it wouldn't necessarily be in a fatal, it wouldn't necessarily affect me badly. It would just be fever-like symptoms. I did not know that information. Many people don't know that information, that you need to be more careful if you're a pregnant woman. So I think they need to take more of an effort to just educate people so that they know the dangers of this disease and who is most at risk. Because right now, everyone might be panicking for no reason, whereas we're not necessarily all at risk. But we just need to be cautious, especially if you are pregnant and you plan to travel to areas where this disease has been reported to have spread rapidly.
Thank you so much for that. That is Sipho Stuurman live to us from Pretoria.